When I think about that, starting a company that is in digital health with trying to have continuous and connected healthcare, it feels like like winning the lottery. It's something that I wish for. I dream about it. You know that there's high risks and the odds are very, very low, but at the same time, it would change everything about the trajectory. And this connectivity for healthcare is not any different in any way, shape, or form. And we have a whole host of great business leaders on this stage to talk a little bit about it. So first, would everyone go through and just introduce themselves in a short snippet, and we'll talk more about each of your businesses and experience as we go. Why don't we start with Shauna here and go down the line?
Hello, everyone. My name is Shauna Overgaard. My focus is the Mayo Clinic. I work on AI translation. So what that means is taking our AI models that are developed in research and working to get them into clinical practice to bring benefit to the patients. Senior Director of AI Strategy and Frameworks, as well as the co-director of our AI Validation and Stewardship Program.
Good morning. My name is Sree Chaguturu, and I'm a practicing internal medicine physician. I'm also the president for healthcare delivery, and I come from CVS Health. So CVS Health, our mission is to be the most trusted healthcare brand in America, trusted healthcare company in America, and we have multiple companies underlying CVS Health. We have Aetna providing healthcare benefits for 25 million plus individuals. We have our Caremark, our pharmacy benefit manager, which provides drug coverage for 1 in 3 Americans, so 100 million plus. We have our retail pharmacy, which has 9,000 locations. 85% of Americans are within 5 miles of a CVS pharmacy. And then the fourth vertical, which is the vertical that I lead, is healthcare delivery, which is comprised of Minute Clinic, over 800 locations. We've been quietly transforming that into a primary care platform. So by the end of the year, we'll have 500 locations, one of the largest, if not the largest, single primary care platform in America. In addition to our acute care services, we have Oak Street Health, which provides value-based care for seniors in over 20 states under Medicare Advantage value-based contracts, and Signify Health, which is the largest provider of in-home health assessments, 3.5 million in home visits that we provide each year. So really excited to be here.
Hi, good morning, everyone. Ann Allen. I'm Chief of Strategic Partnerships for Amazon Health Services and One Medical, and delighted to be here. I've got about a 20-plus year, I'm aging myself, a career in healthcare, starting in the VA, and delighted to see a VA on the panel earlier today. Making my way through Kaiser Permanente, both on the medical group and the plan side, Bon Secours Mercy Health, and then now arriving at Amazon Health Services and One Medical, where we're really reimagining primary care, bringing quality care to millions of Americans, making sure that it's convenient and accessible. And we've talked a lot already this morning about the variety of different paper cuts that we feel in healthcare and in our industry, and some of those are big and some of those are small. But as we're thinking about bringing that customer obsession, the technology innovation to the table, at Amazon Health Services, we're convinced as we start to solve these paper cuts, we're going to look back a few years from now and realize we've made such a transformation in care delivery and in our healthcare ecosystem in totality. Delighted to be here.
And I'm Michael Gorton, 15-time serial entrepreneur. Company number 8 was a company called Teladoc, which kind of transformed the industry, and we'll talk a little bit more about that as we go through this panel.
Amazing. So when we think about healthcare 2030, that seems in the future. But I'd like to start by looking at a historical perspective and going back in time. And Ann says she's dating herself. I just want to tell you, when I got out of business school, I had a Palm Pilot. I was very proud of that. And in 2000, I got my first cell phone, which was a StarTech flip phone that I proudly wore in my back pocket. And then I went to a BlackBerry. So this is the age that we're starting off when we're thinking no EMRs, fax machines were high tech. And then, yet this is the era in which Michael was starting Teladoc. And I'd love if you would start by talking a little bit about how did you think about a new care delivery platform in a time when healthcare was not trending with the technology innovation of the .com era?
Well, in 2000, if you wanted to talk to a doctor, You'd call the office. They'd say, come in next Thursday. You'd take a half a day. And when we started Teladoc, we said, we can fix this. We can make it, in the beginning of Teladoc, it was 3 hours or it's free. Teladoc was my first healthcare company. I had no blanking idea how hard that was going to be. There were no electronic medical records. There was no national network of doctors. And we built an electronic medical record just for the doctors, and they hated it. And we ended up solving that problem by going to the doctor's office and saying, what are you doing right now? They'd show us a clipboard. Now, I don't know, there were probably 5 or 6 different versions of the clipboard. So I went back to my IT department and I said, make the interface look like this. And then the doctor started liking it. Here's the thing that I had no idea about, because we thought, this is such a great innovation, it's going to change the world. And then the sheriffs from the various states started coming to our office saying, Mr. Gorton, you're going to prison. And so, when we sign up to be entrepreneurs, I was talking to somebody.
That's very archaic.
Yeah. So, we know it's going to be hard, but we don't ever think, I'm going to go to prison for doing this.
And what was the biggest resistance that you felt? Was it the concept then about doing care differently? Was there actually that resistance to the technology?
No doctor should treat a patient they've never touched. That's what the boards of medical examiners said. And we fixed it because all the doctors in the room will appreciate cross coverage. You don't work 24 hours a day, so you get your friend to cover for you on Tuesday, you cover on Thursday. That was okay. And the friend, if I'm the patient, that friend has never touched me. So that's how we solved that problem. We just taught the boards, this has already been happening, we're just fixing it.
So as old as Michael and I are, we're going to move to Ann, who's a little younger. One Medical started around 2007-ish, so still back in the archaic dinosaur era. Maybe you could talk a little bit about that new model, that primary care, use of technology, and patient communication.
Yeah, absolutely. And Michael made me remember my days in the file room where the file was never in the color-coded position that it was supposed to be, and you could never find that paper file. Gosh, thanks for taking me back there, Michael. Yes, Shelly, 2007, One Medical was founded in San Francisco, and the founder really was asking the fundamental questions that, frankly, sometimes we still ask today. Why must I wait weeks upon weeks to be seen? Why do I only have 7 to 10 minutes with my provider? Why doesn't my medical record follow me wherever I might go? It's a little concerning, right, that here we are almost 20 years later still talking about the same things. But what inspired the organization at that time was, let's work backwards from the patient and create a completely different approach and model. And that's where One Medical was born. 30-minute appointments, so dedicated time to talk to your provider and clinician. 24/7 wraparound virtual medical team that hadn't existed prior to that. Somebody who could pick right up after your provider ends their day at 5 o'clock in the afternoon and continue to provide care for you and know you. And starting to build the infrastructure on the technology side of equipping people in their mobile devices to be able to book appointments, renew their prescriptions, have access to their health information, all the things that should be easy, really creating that infrastructure and chassis so that patients could do what should be simple. And that's where it all sort of began. Then also creating our own EMR. We have a proprietary EMR in One Medical, focused again on building it so that we were reducing the administrative burden. That was of utmost importance. And then making things convenient, bringing practices and offices close to where people live and work. Again, if we start to make things easier for the population, for our patient and customer, they'll be able to do the right thing and care for themselves in the right way.
Now, by 2007, I had abandoned the Palm Pilot. My StarTech was in the drawer, completely gone. I did still use a BlackBerry, but iPhones were the rage, starting that first iPhone 3 or whatever it was called. How did you start thinking about patient communication way back then we're still in the old days here, in with so many different modalities that were changing so quickly?
Yeah, from the very beginning, the tech was really purposely built to enhance the human relationship rather than to replace it. And you already heard me mention the virtual medical team and the wraparound support. The care team approach was very important so that there was technology and infrastructure built behind the scenes. So again, everybody's working in tandem, in collaboration to care for that patient. Being able to message and have that asynchronous relationship with their providers also became, maybe now we think it's a burden, and it can be at times, and we're thinking about solutions for that. But at the time, it gave patients an outlet to be able to connect quickly, get answers. So when they came in for that visit, it was 30 minutes spent on what was most important to that patient of getting resolution, and that provider had that quality time to spend with the individual. So again, the technology is augmenting and supporting the relationship, not replacing it.
Now, this is the fun part in that while we look back at 2000, 2002, and 2007, it seems really old. But Sree, you're the old one here in that CVS has been around since 1963, so 62 years old, and therefore by default has extraordinary legacy systems across, they're different across all of the different stakeholders and segments of the business. Talk a little bit about how important or challenged it was for CVS to start thinking about a connected system.
Yeah, and CVS Health is not the oldest part. So Aetna is over 150 years. So you go down into
Hold on to the
old
chairs.
you go into the Hartford office, we have like the safe that has the original property and casualty documents. I mean, it's, so talk about a legacy infrastructure with multiple different companies. And then I mentioned some of the newer companies that we have, like Oak Street Health and Signify Health, which are built on modern new platforms because they've been built in the last couple of years. So we have this broad range of different companies. And so as we think about how do you decide what to unify, I remember asking, and re-platforming, just about a year ago, this question to an entrepreneur in Silicon Valley who is very deep in the AI space. It's like, when should I do it? And he was like, this is a really hard question because the cost of re-platforming is coming down substantially as AI coding becomes much cheaper. So there is sort of a question that you have to ask of when do you want to actually re-platform? And then when you do that, it's also based on what is the business use case that you're trying to solve for. So we have re-platformed our pharmacy and we'll be completing that over the course of this year. So this is a legacy system that's 20 plus years old. It's called RX Connect. We re-platformed it because we were looking to connect our retail health experience with our specialty mail and our mail order, because many of you who receive your prescriptions are receiving them from multiple different places. Sometimes you go into the pharmacy, sometimes they get shipped to you. We needed to reconnect them. But in addition, we could build additional experiences on top of that. So an example of that is virtual verification. So if you go to a pharmacy, people will be counting pill by pill, but gosh, couldn't you just take pictures, count that, make sure that no prescriptions are being commingled with what was done before, make it a safer experience, but also reduce the amount of labor and dispensing. So that might seem like a silly small thing, but it by re-platforming, allows us to build additional experiences on top of that. And then the other area that I would look at is connecting, so vaccine scheduling. We used to have two different platforms. We used to have pharmacy platform and Minute Clinic platform. But when you're scheduling, you don't really care. You just want the vaccine and you want one uniform place where you can go. So we had a use case that we didn't have to put together the scheduling systems before, but because of vaccines, it created a business use case for us to actually invest in re-platforming. The reason I share these, they're pretty mundane, but it shows the importance of, and I'm sure my colleagues here on the panel would agree that you could re-platform and you could spend a ton of money on infrastructure projects, but if it's not built on business needs first, then they become flights of fancy and incredibly expensive with nothing to show on the back end. So understanding what is the business imperative then drives the re-platforming discussion.
And a big one back from the same time frame was we'd all go to the doctor and we'd get a paper prescription. We would then go to the pharmacy and fill it. And I can't even, my children would never fathom that that was the case. And yet, electronic prescriptions are still, what, 25 years old now. So maybe just make a quick comment on that and how transformative that piece of information was to the business model as a whole.
Yeah, I mean, there's plenty of these examples. So ERX, electronic prescriptions, has really allowed us, one, it's been much better for the patient because you don't have to lose that prescription. It's much better for the physician because they have the ability to use the clinical decision support that's in the electronic medical record to make sure that this is the right prescription for this patient. But also on the back end, and this is part of why we did RX Connect as well, replatforming, is we could build the secondary safety systems on the back end to make sure that these prescriptions are correct. So, once you digitize, it allows for each of these stakeholders to create additional, benefits for themselves. And so the physician EMR community is doing something, but we're also doing something on the pharmacy side to make it better for our pharmacists to be able to dispense medications.
Isn't it fun to walk down memory road here a little bit? So this is the last one that I have, but it is the oldest. So Shauna, you are really the dinosaur, because when I look at the Mayo Clinic, it's so steep in rich history and the research and the combination of clinical, but it started in 1864. So you're 162 years old. You look good too, by the way.
Thank you, I appreciate that.
So maybe you could talk a little bit about the historical perspective of how you got that research connected with the clinic, which is such an important driver for the Mayo Clinic business model.
Thank you, and I appreciate the comment about my looks given my age. In 1907, Shelly, if I could go back there, there is a hero of mine named Henry Plummer. So at Mayo, during orientation, we are in fact heavily steeped in the history and culture, in part because it helps us advance our thinking, our innovative approach, our team-based science, the interest in constantly adapting. And so with the 1907, oops, that's okay. Thank you. Actually don't need these notes, but it gives me some comfort just to have them around. 1907, Henry Plummer was an innovator and engineer. He considered the fact that the notes that were being created on patients really had to do with more event-based documentation. And so what he did was, I mentioned the team-based science aspect. He determined that to be able to document on a single patient and then have each of the providers also document on that single patient would be a way to advance not only the insight, but also the knowledge continuity and then the data collection. And so trained in bioinformatics and biostatistics, I find that incredibly powerful, which, as you can imagine, now we think, of course, why else wouldn't we document that way? But to think about the fact that it was, in fact, novel at the time. Taking that a step further, in 1930s, thereabouts, survival analysis was introduced. So this really allowed Mayo Clinic to bring in the knowledge of what type of impact is this having and on whom, what are the specific risks associated. And so these are, I think, foundational aspects of Mayo Clinic's history, along with many other areas, but those two specifically stand out to me just given my area of interest and expertise.
So now, given we're about 17 minutes in, we're going to switch to more of the now factor and take a look, think about what's different today than it was. So we're going to start with Shauna, because what I think is profoundly interesting is that your hero, Henry Plummer, would probably be idolizing you at the moment as you talk about all the work you're doing at the Mayo Clinic in AI. So tell us a little bit on our prep session. It was really profoundly interesting. So take the floor there and talk about what is different today.
Thanks.
Your great project.
Thank you. Yes, I've often thought about how can I emulate Henry Plummer, and in addition to having really cool glasses as he had, I have been thinking about what system can we collectively build to prioritize the needs of patients? So for me, this also had to do with documentation. So something that our teams proposed was documenting on an AI solution itself, all the way down to the foundational data elements of metadata. Along those lines, though, bringing in each of the stakeholders to do that documentation, thinking about the developers, our data scientists, biostatisticians, clinician informaticists, clinicians themselves, and you can think about the entire AI life cycle and all of the stakeholders involved. Everyone has a specific evaluation criteria and function that is intentionally needed to be able to make the communication from one step to the next. And so in theory, if you can imagine the concept, there are ways that we can preempt what our partners in the AI lifecycle, development, deployment, maintenance will need. And so to do that documentation is something that we now have the infrastructure for as well. In terms of actual translation into a broader approach and practice, some of my work in partnership with Grace and others through the National Academy of Medicine AI Code of Conduct had to do with bringing, similarly, all of the stakeholders in the ecosystem, but from this perspective, the patients, health systems, payers, regulators, innovators, developers, just to create commitments as to what it means to be able to appropriately and ethically build and develop and essentially prioritize patient needs. Something that we're doing now is working to create a co-development space. So I led the health systems and payers working group through the National Academy of Medicine. And Laura Adams, this senior advisor to the National Academy of Medicine, when I was talking about how to approach this, said, Shauna, think about something that health systems can do that they're not currently doing right now that would enable others in the ecosystem, developers, payers, regulators, et cetera, to meet those commitments, to prioritize patient needs. And so foundationally, I thought there's opportunity for health systems to step outside of themselves in the sense that health systems expect there to be rigorous evaluation, documentation. We expect there to be low risk, but there's also this opportunity to partner with developers to be able to express what those expectations are, as well as to do preliminary analyses and co-development toward translation of AI solutions into clinical practice. When we have AI developers present, say at the end of our Accelerate program through Mayo Clinic platform, what they'll still say is, I would love a way to be able to bring this into clinical practice. So what does it look like to partner with those in the ecosystem to do that? And so something we're, and actually Laura will be presenting on this today, but developing a living laboratory, but something that's more globally positioned to be able to co-develop AI solutions, again, prioritizing patient needs, but also bringing patients as the center of that development.
Absolutely no pressure, Sree. CVS has got very, very big shoes to try to compete against, but maybe you could make a comment around how does CVS, with this whole host of the old, the new, and the hopefully soon removed, how do you think about building for in today's environment for connectivity, continuous care?
Absolutely. So, I started out with a comment that we are striving to be the most trusted healthcare company in America, and we do that through engagement and experiences. So, if you think about our platform, we have 40,000 clinicians that work at CVS Health, and we know that our trusted clinician, like Karen, I think is what you mentioned about nurses, pharmacists, doctors. If we want to improve healthcare outcomes, on the back end of that conversation needs to be a trusted clinician who can help guide you through those conversations. And then it's about engagement in locations, and that locations is going to be omni-channel. So I talked about the in-person locations that we have, but it's also digital. And so let me ask you all this question. If someone's brave and can answer, what's the number 2 medical app on the Apple App Store right now? Number 2. MyChart. So what's number 1? No, CVS Health. CVS Health.
Can
I
somebody
think
ask
ChatGPT
ChatGPT to verify that,
might be
please?
like in the general search thing, but yeah. So, but what are we trying to do with CVS Health's app? And so what we've been doing is redesigning this to become a healthcare super app. We've been asking consumers, would you want to go to a single location to help unify your experiences? And we've been doing that through CVS Health's app to unify the pharmacy experience with the health benefits experience, as well as connection into our care delivery assets, tailoring those through AI experiences that are personalized to you. So you might be somebody who's motivated by convenience on getting your vaccine. For me, it's cost. So the messaging would say, no cost to me, here are the convenient locations for you. So creating those personalized experiences. And then we are striving to make that an open platform for others to be able to utilize the CVS Health app to create those digital experiences. So that engagement is not just in our clinicians, it's not just in our locations, but it's in these digital experiences. And we have now 65 million Americans who are digitally engaged with CVS Health. So you might think of us as an old pharmacy or health benefits company, but we are also seeing ourselves as a technology and engineering company to help use those skills to help drive engagement and health outcomes.
Cool glasses would help too. Cool glasses.
Yeah, exactly.
So I love the 65 million users, really impressive numbers. But then you think about Amazon and the consumer experience. And I'd love to have you, as a consumer, I think of fast, convenient, on my phone, on my app. Talk about how the One Medical and Amazon partnership has approached it from a consumer perspective.
Yeah, well, I'll step back first and just, when Amazon acquired One Medical, we had established a comprehensive care delivery footprint. So we've got about 200 physical locations across the nation, 200 plus. I already mentioned the 24/7 wraparound. We've got health system partners that provide that continuity of care when primary care needs to end and we need to hand off to a specialist, and so work with some of the most prestigious health systems across the nation. And so we've got the point is we've got a very solid, great foundation to work from. Then you start layering on, to your point, Shelly, about the customer obsession and the tech-enabled convenience. And so what I think is, maybe it's serendipitous that Sree and I are next to each other, but I think it's so great to be able to walk into a One Medical office. And what AI is bringing to the table is the ability to surface easily for the clinician those preventive care gaps, making that easy, identifying if there's medication reconciliation that needs to take place or an adherence issue. The provider can then see if there is a medication that needs to be dispensed through Amazon Pharmacy. They can see what the cost is, right? So we're going to have the cost barrier discussion, and then is it in stock? We're going to have the conversation about convenience. Oh, and then let me deliver it to your door today, and in some markets even able to do that same day. So that kind of experience before you even walk out the door of your 30-minute visit with your primary care is probably unmatched and unbelievable from a patient consumer perspective. I also think it's what I also enjoy about seeing as we're leveraging AI is just, I call it care guidance, care routing. We're getting patients to the appropriate destination of care. So I may not need to have an in-person physical appointment. An asynchronous conversation might be just fine for what I'm seeking to learn and engage with and need clinical advice about. And so getting patients to the right destination, we talk about that a lot, right? Getting people to the right place the first time. We're going to be able to do that effectively and efficiently, and I'm super excited about that.
As a consumer, we always think about wanting things quickly, fast, access to information. I had a recent experience where I had a prescription for my son who had surgery. He's 15, and it's about 9 months later, and I'm still getting regular messages from the pharmacy saying it should be delivered next Monday. It was not CVS though. So your competitors are not keeping up. I would love to start back with Michael then and talk a little bit now, 8-time entrepreneur, repeat entrepreneur, and if you think about the trajectory of where we are in technology today, what do you see stands out across all of the various business lines that you've been involved with?
I think we're starting with kind of a funny story. Christmas 2 years ago, last gift for my wife. She opens it up. It's a scale, you know, the kind you step on in the bathroom. So to the
This is
guys
not
in the
ending
room,
well.
I will tell you, if you do this, the next thing that happens is it's flying towards your head and you're dead. Except that Shelly and I are both very data-centric. And there are scales you can buy now that give you tons of data. And that data is so valuable. If we had had access to all of the data you can get from just standing on a scale for 15 seconds every morning, the future of healthcare is more about catching things before they get expensive and dangerous. And when I think about, you know, where we were, and at the beginning of Teladoc, we played around with trying to do video. You couldn't do it. Nobody knew, the doctors couldn't figure it out, and the patients couldn't figure it out. And so we just abandoned it, and we had a simple phone. And, but what we did have was lots of technology behind the scenes. So if you were an interstate trucker driving from LA to Florida, and you got sick, but your load needed to make it on time, what we did was we had a system inside of Teladoc where you could call in and you'd say, I'm on Interstate 10. And now, the pharmacy people will know if you write a prescription in Texas, you can't fill it in Louisiana. And so we had to have people that were looking and saying, okay, you're on what highway, how fast are you going? And then they had to figure out, you're an 18-wheeler. Where you can't pull into a CVS, where can you pull into? So we had to figure out all of those little pieces, and you don't think about all that technology behind the scenes, and now we have AI. And you know, the only thing I'll tell you about AI is if you're not using it, you better start really fast.
I went to a healthcare conference 2 weeks ago, and one of the technologies that I was asked to preview was to take this app and put it up against my face and hold it for 15 seconds and do a little bit of this. It was a little uncomfortable because people were looking at me, but what's interesting is I had just had blood drawn 2 days before. This app accurately predicted every single thing on my blood draw. I was skeptical, including my A1C reading within 100th of a point. So connectivity, access to data, cutting edge information, whether it be sitting on a scale. Did she appreciate the scale? I'm really dying to know. Or did you get yourself in trouble? It's not the last gift. That should be the first, just advice for next year. But, okay, so now in the last bit of time that we have, I want to see, it's about 14 minutes. Is that right? 10 minutes? I'd love to ask all of the panelists, and we'll start back with Michael. If you were to have a wish for the future, healthcare 2030, what would be something that you would recommend for entrepreneurs, companies to be paying attention to right today?
Well, I want doctors to have AI in their ear, because the doctors are the smartest people who come out of medical school or out of the university, but they're so busy. They're making mistakes. I think it was the Hopkins study that said 250,000 deaths a year from medical mistakes. And they're making mistakes that they shouldn't be making because they are that smart, but they're so busy. So they need to have AI listening and saying, maybe it's not this, it's that. That's one thing. The other thing is more data. If the solution to our healthcare system, rising costs, is catching things early. If we catch it before it gets expensive and dangerous, we help solve the problem of our care system.
So I just received that we have less than 5 minutes, so each person will get about 40 seconds.
Gosh, the pressure's on. Being a part of a primary care focused organization, I'd have to say that making sure we put priority and incentives, aligning incentives around the relationship between a patient and a primary care provider. We could save $67 billion annually if we started with having a relationship with a PCP and a patient. It could be that simple. The other piece of this is what I call bridging the intention action gap of, I've got an idea, I've got thoughts, I'm browsing on the web, but now I've got to get those intentions to action. And on Amazon.com, on the Health Benefits Connector, we're actually bringing those intentions together with preventive care gap companies that can help people start to take action and move in that direction of having the autonomy and taking action around their healthcare. So a couple of things I'm thinking about.
Okay, Sree, 30 seconds.
Okay, real quickly. So all the usual stuff like interoperability and everything that my colleagues have said. I would say also I get pitched a lot of different companies, and what I find is many of them are great on paper, but they haven't actually done the full contact sport of being in the clinics, being on the ground. And innovation is, I think, got to be a full contact sport. I mean, as I think about how you did Teladoc, you were there side by side with the clinicians and the patients figuring that out. So the more we can be close to the problem, the better our solutions will be.
And Shauna.
Allowing patients to own their data. I think that on a moment-to-moment by basis, it's patients that make decisions about their health. I think that it's time to democratize that and really give patients their own databases, quite frankly, coming from a bioinformatics perspective.
My wish would be price transparency. I hear all the time. What is it going to cost me? $1,400 or $40? I don't know. But in closing, I'd love to thank all of the panelists, and I really thought a lot. I loved the MacGyver example. I love the Knight Rider, and I wanted to give my own little hope for the future. Here's Dukes of Hazzard. That's Dukes of Hazzard. They never saw the challenges in front of them, and they never said it's too high, too fast, whatever it was. They just soared. And in Healthcare 2030, that's what we should strive to do. Thank you.